Welcome to The Backstory. I'm your host, Anne Hancock Toomey. Over the course of my career, I've had the privilege to work with and learn from and guide some incredible leaders, mostly in healthcare, but not always. The Backstory is a chance for me to talk to some of them, unpack who they are and where they came from, and how it all influences who they are today and how they lead. Ultimately, each conversation offers a case study in what I'm calling authentic leadership. Let me now invite you into our conversation for the real backstory. Today, I am fortunate to be joined by Ric Ransom, CEO of University of Missouri Healthcare and a longtime healthcare executive with several major health systems. Ric is a highly engaged leader and an advocate for protecting rural healthcare. He's also a proud father and grandfather and a self-proclaimed nerd, which we're going to learn more about here in a minute. Welcome to the podcast, Ric. It's so good to be with you.
And thank you so much for the opportunity to talk with you today and to be on the podcast.
Yes, sir. Well, Ric, as I've shared with you, this is a podcast about authentic leaders who get the best from others because of who they are and how they lead. And I happen to have 4 colleagues who have worked with you separately in 3 different organizations along your career journey at MU Healthcare, at UW Health, and at Prisma Health. And they unanimously and enthusiastically urged me to talk with you because you are truly an impactful leader. You're known for developing great teams, for having a knack for quelling anxiety and building consensus. You have big ideas, but you also know the power of listening and embracing the input of others. And you're really fun to be around. So how's that for a profile?
That is way too kind. I'm going to have to tell my family all the nice stuff that you just if I can get my wife to believe that.
I hope they're listening. Yeah. All right. Well, there's much for us to learn from your career and from your life journey. And if you're ready, we'll dig in.
Let's do it.
Okay. All right. I'd like to start from the beginning, Ric. You are obviously solidly in the Midwest today, but you grew up in the South near my neck of the woods. I would love to hear about your family and how you grew up.
And I am originally from Birmingham, Alabama. I was born and raised there. My nuclear family is actually pretty small. I've got a brother who's about 6.5 years younger than me. And it was just the 2 of us, my mom and dad, growing up in Birmingham. My dad is a retired physician, and my mom was a French teacher when I was growing up. Went to Catholic schools, and interestingly enough, spent my summers here in Missouri. So my mom is from Kansas City originally. I went to school in Atlanta, and as a teacher, she was working on her master's degree with 2 kids. It was always part-time in the evenings, and she would ship me and my brother off every summer so that she could take some classes towards her master's degree. So I spent all my summers here in Kansas City growing up. I would describe it as a fun, really enjoyable overall childhood.
Are you fluent in French?
I do not speak French. It was interesting. My dad studied for a year in France, and my mom is a French teacher. Actually, I've got a kid who's in Paris right now studying abroad, but no, not a lick of French.
It's not too late. But now, with your dad being a doctor, you grew up around healthcare.
I did. So as the oldest, I was born as my parents were finishing college. So when my dad started medical school, I was an infant who essentially grew up while he went through medical school and completed his training. His work in healthcare was always something that was important in our family and in my life.
So what is a memory from growing up that you recall that was formative?
So I will describe a series, and it really has to do, I think, in part with my interest in working in healthcare and hospital systems now.
Okay.
I was diagnosed as an asthmatic at 5 years old. In the 70s and early 80s, a lot of the really cool medications to manage and control asthma didn't exist. Treatment for me was going to the allergist and getting epinephrine shots 2 or 3 times a week to make sure that my asthma didn't act up. And almost once or twice a year, from the time I was 5 until I graduated from high school, I would get pneumonia or the flu. It would be exacerbated by my asthma, and I'd end up in the hospital. And so the memory that really strikes me is as a child having an asthma attack and not being able to breathe and getting taken to a hospital to get treated, the kind of magical effect that the treatment of my asthma by people in the pediatric emergency room. So as a kid, you don't understand everything that's necessarily being done to you. But what I absolutely could understand, and which, still stays with me today, is going to the emergency department, not able to breathe, having a respiratory therapist and a nurse and a pulmonologist give me a shot, or later, and as I got older, give me a nebulizer treatment. And going from scared and not able to breathe to being able to breathe and being more relaxed, there's an element of what clinicians do in not only treating asthma, but treating all other kinds of conditions that's miraculous to people who don't necessarily understand the science behind it all. And that feeling has never left me.
Yeah. What you're describing is how they made you feel. Not only like how they helped to heal you and get you back to breathing normally, but they made you feel comforted. They made you feel welcome. They made you feel like it's going to be okay.
Absolutely. In retrospect, it's the care part of healthcare. There's treating the underlying illness, and then there's taking care of the person.
That's right. Well, so talk a little bit about your first job and tell me, what's one thing you learned from it?
All right. So my first job was as a telephone solicitor. I was working for the Alabama State Troopers Association as a telephone solicitor, selling booster membership packages to folks to see if they would be willing to give a donation to the state troopers. And in return, they would get these stickers that you put in the back of your car.
Oh, yeah.
So as a 16-year-old trying to sound like an adult state trooper, what I learned from that is that I suck at sales. And that telephone solicitation is probably not how I was going to make a living.
I bet. We'll talk a little bit about the first leader that you can remember who impacted you in a positive way. I mean, it could be a teacher or a coach or somebody from the telephone solicitation job. Maybe not. Who's a leader that shaped you?
I am really fortunate in that I've had leader examples in my life from a pretty early age. A lot of them have been in my family. I mentioned my dad is a retired physician. He was the third Black medical student to graduate from the University of Alabama, Birmingham School of Medicine.
Wow.
And after he completed his medical training, he took a job as the emergency department director at UAB Hospital. So one of the leaders that, stands out to me early who really shaped me was actually my dad. A couple of others, I've got a great uncle, Sam Rogers, who also was, interestingly enough, a physician in Kansas City. There is a federally qualified health center, an FQHC, that's named after him to this day in Kansas City. And then his brother, Gordon Rogers, was a city councilman and a leader, as well as being a dentist in rural Alabama. And so as I think about like the first people that I was exposed to that were leaders that left an impact on me, it was some of the folks that were actually my dad and both of my great uncles.
That's amazing. And what'd they teach you?
I think what I learned, and this is as a child, maybe not fully appreciating everything that they did as leaders, what I appreciated was having a heart for service, being connected to the community. An example I'll share, there were stories told to me as a kid about my dad playing poker with the EPS staff and some of the housekeeping staff at UAB during a downtime. And this idea that as the director of the emergency department, to be connected to the people in housekeeping and food services and not losing sight of everyone who's working in the work environment.
Oh, I love that. I love that. Well, we'll come back to that. Okay, so you had been exposed to French, to healthcare, of course, at a young age, to telephone solicitation, to the police force. So you had many sort of examples of where you could take your life. Talk a little bit about going off to college and what you studied, and were you interested in healthcare at that time?
I was not interested in healthcare when I went to college, and this is despite doing some work in my dad's office, like filing x-rays at a different point. I passed out in biology class every time we had to dissect something.
Oh, no.
And so when I went to college, in my head, I didn't know exactly what I wanted to do, but I was pretty sure I wasn't cut out to be a doctor and it wouldn't have anything to do with healthcare. So I attended college at Morehouse in Atlanta, Georgia,
Yeah.
and ended up majoring in philosophy. I liked logical thinking, the idea of being able to analyze arguments and be able to evaluate the weight or the lack thereof of propositions that were advanced. And I did not have a clear idea at the time about what I was going to do with a degree in philosophy. As I was getting closer to graduation, I still wasn't sure what the heck I was going to do to pay back loans. And at the time, and there was a TV show, you're probably too young to remember this, called LA Law.
No, I remember LA Law.
Jimmy Smits and Blair Underwood.
Yes.
In my mind, I had these mental pictures of Blair Underwood in these really cool suits arguing on LA Law. And that's what I thought law school would allow me to do. So I chose to go to law school without the most sophisticated and refined understanding of what either law school or practicing law really was. I finished and passed the bar and practiced law in rural Alabama for about 3 years. And after engaging in the practice of law for a while, I really felt like I wasn't being useful. And that got me to think more about doing something different.
Okay. Wow. Okay. So from philosophy to law school, wanted to be Blair Underwood. Totally understand that. What happened next? If you knew what you didn't want to do, which is just as important as knowing what you do want to do, of course. How'd you find your way to healthcare?
The work that my dad did for sure stayed with me. And as I found myself after practicing law for a couple of years looking to find another way to be useful, I talked with a friend of the family who was a CEO at the time at Baylor Health System in Chattanooga. His name is Skip Reeder.
Yeah.
And Skip talked to me about healthcare administration, pointed out that it's heavily regulated and that my legal background would be useful, that I could work with super smart physicians, nurses, pharmacists, like my dad, and be able to help them do what they do every day, even if I don't necessarily have the same gifts and talents that they do. So after doing some research, I found out there was a great healthcare administration program right there in Birmingham at UAB. I was fortunate enough to get accepted into the program and ultimately did the dual master's program at UAB, where I received an MHA and a master's in business administration at the same time.
Fantastic. What a gift to have someone like Skip speak into your life and help you translate your experience to something that really got you on the right track in your career. Do you still talk with him?
I still keep up with Skip. He's in Houston now, and growing up, he was Uncle Skip, and his wife was Aunt Adrian. Periodically throughout my career, especially when I've had decisions to make, I'll reach out to Skip and try to run things by him or get his perspective on things. Just having access to someone like Skip Reeder has actually really raised the bar for me to try to maintain my availability for young professionals.
Yeah, pay it forward. That's terrific. Okay, well, let's talk about that career journey. Tell me a little bit about your first job in healthcare.
My first job in healthcare was actually while I was in graduate school. So I moved from practicing law, took a chance in going back to grad school. And while I was in school, I worked inside the general counsel's office for a gentleman named Doug Hughes, helping to support the legal operations of Eastern Health System there in Birmingham. All of that was under the leadership of a UAB grad, a guy named Bob Chapman, who retired from Eastern. What I learned is that I was in the right place, right? It's that work that goes on in hospitals and ambulatory clinics there and across the country. That's where I belonged.
You graduate from UAB, you have a little bit of experience under your belt. I believe you told me that you did an internship of some kind or a fellowship maybe at Baylor. Is that right? In Texas?
Absolutely. And so I went from Birmingham to Dallas and I did an administrative fellowship at what is now Baylor Scott White Health System. At the time, it was just Baylor Health System. I completed a fellowship there and then took my first healthcare executive job as a VP of operations at one of the, at the time, 13 Baylor hospitals.
Fantastic. And how long were you there?
Not quite 5 years.
Okay.
Ended up taking a job in Boston largely for personal reasons, and was in Boston with its Mass General Brigham now,
Yeah, of
MGB.
course.
Was only in Boston for a short time. Our family ended up relocating to Atlanta. Dallas for about 4 or 5 years, Boston for about a year. We were in
Okay.
Atlanta for probably 5 to 6 years, and Memphis, Greenville, South Carolina, Madison, Wisconsin, and then I've been here in Columbia for sneaking up on 2 years.
Holy cow. That's a lot of moves.
The folks that you said had something to say about me, I told you I've been around. And the good thing about some of my professional journeys has been that I've got a chance to know some great people, to work in some amazing places. And
Yeah.
I like to think today that the experiences that I've gained prepared me for the role that I'm in today.
Yeah, I'd say so. So your experience has really been a mix of academic medicine and some of the more rural or regional systems, as I think about South Carolina, for example. You tell me a little bit about what you learned in each of those very different environments.
Yeah, the common theme has been all of my work experience has been in not-for-profit healthcare.
Yeah.
Most of it has been in academic settings, but some of it has not been in academic organizations. And then the idea that there's this strong commitment to community and rural healthcare has been another kind of theme in terms of my professional experiences. I've had some tremendous role models in each one of the places that I've been professionally. And I also I've led in interesting times, right? There's a curse, I think, that may you live in interesting times. As I think a little bit about my experiences in South Carolina, Hurricane Matthew, because of the COVID pandemic, people tend to not think back on there was an Ebola scare, and having to lead in a healthcare system at a time where there were things that were valid operational concerns that health system leaders across the country were trying to manage through. So as I think a little bit about each one of the places that I've had a chance to work, themes have been leading through change, leading through interesting and sometimes difficult times, and helping to support growth, I guess would probably be the third theme.
Those are formative, right? Leading through change and leading through crisis for sure. And one of my colleagues shared with me that you were, I believe, incident command officer of the system where she had worked with you, and that you are cool, calm, and collected, and always are able to quell the anxiety and the nerves of others in really intense moments. How do you do that?
I did have the opportunity during the early stages of the COVID-19 pandemic to work with a really talented group of leaders at the University of Wisconsin. And my affect, I tend to be pretty laid back and I don't get rattled much. And I honestly don't know where all of that comes from. I try to, if I'm going to have a bad moment, I do it at home. So, like at work, I just tend to be very even keeled and consistent. I think a lot of that is I have faith and confidence in structure and processes in academic systems. So I don't feel like I have to always have the answer. Actually, quite the opposite. When I'm at my best is when I'm making sure that the team has the right resources, the right structure, the right processes, and is that working as intended? And so I think part of my approach is that I'm not a superstar leader. Rather, I think that I do a good job supporting teams of talented people and trying to get the best out of them. So during the pandemic, we had an incredibly talented medical branch officer. We had logistics folks, like the team that was there at Incident Command. It was the right group for the right moment in time. The confidence that I had was really because I was surrounded by such great people.
So, Rick, I would love to hear a little bit about your perspective, having moved around from Texas to Boston to Atlanta to South Carolina to Wisconsin and now Missouri. I think I may have gotten all the stops. Hopefully I did. That's typical of a career, particularly when you've been around for a little while. I'm curious, how do you know when you're done with a particular opportunity? How do you know when it's time to go to the next thing?
In terms of my long-term aspirations, so I'm here. When I was in graduate school, Kevin Lofton was the CEO at UAB. I remember very distinctly hearing him speak and thinking, Man, it would be amazing if I could be the CEO at an academic health system at some point. And I'm incredibly blessed. This really is the highlight of my professional career to be able to serve here.
Yeah.
So in terms of like my career journey and where I am, I'll be 56 in a couple of weeks. This is where I want to be. As I look back on the steps that I've made, I had a gentleman, Otis Story, who was a UAB alum, worked at Grady, worked at Shands, worked at a couple of other places. He told me early in my career that every 3 to 5 years or so, you need to be looking at how you're growing. So
Okay.
it doesn't mean you need to move. That means you need to be growing. And in all honesty, it's preferable to be able to grow in place, right? You need to be
Sure.
growing as a leader, learning new things, being able to support new areas. And if you're not growing every 3 to 5 years, you ought to consider a move, right? So that you're able to continue growth. And that guidance that I got from Otis, like right out of grad school, has really stuck with me. I think the focus, though, is less on ladder climbing and more on, am I growing into the leader that I need to be in order to be useful and of service?
Yeah, that's fantastic advice. I love that. Okay, so MU Healthcare, you've been there about 18 months. This is your first gig as CEO. So tell me, what has surprised you about the role of CEO?
Most of my surprises have been of the awesome variety, and the responsibility for owning all of communications is something that the significance of that and how much time, effort, and discipline that really has to go into how you communicate as a CEO, the quality of that is something that was surprising to me.
I bet. The constituencies are innumerable for a health system CEO, internal stakeholders, the external stakeholders, the government stakeholders. You're constantly communicating.
Yes. And then the responsibility of serving as a senior executive and being a CEO, people pay a lot of attention to what you say. And there is the risk of misinterpretation, right? And
Yep.
so the responsibility that comes with communicating effectively and not participating in hyperbole or doing things in such a way that communicating effectively, but managing people's emotional response to your words.
That's
Like, so
right.
the significance of how I communicate and the impact that I can have on people in unintended ways,
Yes.
that's something that surprised me and has been a learning experience for me.
I'm sure. I don't know if you have found that at times you might be just thinking out loud and people think, oh, that's a decision. And I now need to act.
Exactly. And I am an out loud thinker.
Yeah, me too.
Right,
It's
right. So I like
dangerous.
to process things by verbalizing them. I've got to be careful. I've got to be aware of my surroundings and who's there and who might react to something that to me is just I'm processing something and it could be interpreted a different way.
Exactly. All right. You've had an extraordinary career and you have much more to accomplish, I'm sure. But as you look back on the last, say, 30 plus years in healthcare, what's a career accomplishment that you're most proud of?
This is not and really an accomplishment, but I'll tell you the thing, when I hang up my spurs, I will think a lot about the leaders that I've been able to work with and the growth that they've experienced. I worked with a lady named Lindsay Stencil, who at the time she was a director of physical therapy and rehab therapy in Memphis. She's now a hospital CEO in Memphis. I worked with a lady, Nikki Stafford, who was at a director level in South Carolina when I was working with her. And she's president of the American Family Children's Hospital in Madison, Wisconsin right now. So the people
Yeah.
that's not an accomplishment, but man, I really like to watch people grow.
Wonderful. You don't seem to me like a guy who dwells much on regrets or mistakes, but all good leaders are self-aware and acknowledge that they're so imperfect. Do you think back on your career and are there any mistakes that pop to mind that shook you or shaped you?
Heck yeah. Talk a little bit about just mistakes generally. And I am one of those folks that tends to be much harder on himself than others are. So I tend to be my own worst critic. What I've done over the years is given myself progressively less time to whine about mistakes, right? Or to wallow in, I made a mistake. And so I think the thing that I'm proud of is the resilience. And if I make a mistake or if I don't get an outcome that I want, I'll give myself, all right, man, you can go home and eat some ice cream and be mad. And then tomorrow you got to get it together and come back in, and that's behind you, and keep going. If you're not making mistakes, you're not taking chances.
That's right.
I definitely make them. My team makes them. What I think, if anything, separates us and how I try to address mistakes, it's in how we respond to them. One mistake that stands out to me that I made mid-career had to do with the termination of a leader. Ultimately, that was the right decision, but in managing that person, I did not do the job that I needed to in providing them timely feedback about their performance. And so when we got to the moment of, okay, this person needs to be separated from the organization, they were surprised. And in retrospect, that really is the main unfairness that comes from those types of situations. What I want is for me to treat people the way I would want to be treated. So if I'm not doing something well, tell me about that, give me a reasonable opportunity to address it. And then if I don't, then I need to be held accountable for it. And as I think back on the experience with this particular person, that discipline to have timely feedback provided, to give them the reasonable opportunity, and then hold them accountable, that didn't play out the way that in retrospect I wish it would have. So the experience then is I got to call them like I see it, right? So if there are problems with someone's performance, I have a responsibility to them and to me to tell the truth about, hey, here's something that didn't work out quite like we intended or we discussed. Here's what I would suggest you consider. Let's look at some sort of period of time where that needs to be turned around or corrected. So the mistake that stands out most to me was the process or the way that I handled those disciplinary discussions.
Thank you for sharing that. And you're not alone. I think every leader, as they progress through their career and manage more and more people, face the same conundrum, right? It's good maybe that you faced it in mid-career, so you've been able to approach it differently, but it's the people part of business that sometimes is the hardest. It's the greatest and sometimes the most challenging. Ric, before we talk more about leadership, I would love to hear a little bit about your family. I know you have a whole gaggle of kids and grandkids that you are so proud of. Tell me about your family and also about your family in the context of your career.
Gaggle, I think, is the technical term for my family. So I've got a big, beautiful family. We are a blended family. So we've got a Brady Bunch, 3 sons and 2 daughters. So I've got 5 kids and 5 grandkids. All of my grandchildren, interestingly enough, are girls. Everyone is healthy and beautiful and just amazing. My nuclear family, my mom and dad are both still alive. And then I have a brother who is a physician in Atlanta. So when I think about my family, that's who really I tend to think about.
Oh, that's so wonderful. Well, you know, every leader has so many dimensions that and competing priorities that they have to juggle in life, family and career. And you mentioned service earlier in our discussion is so important to you. How do you manage all of those important dimensions?
The best I can. And so this is one of those areas where I think I've got a reasonable balance, but I won't claim to have everything right here. So family recharges my battery. And I didn't really describe this earlier, but I actually consider myself to be fairly introverted. But I love what I do. And sort of like you have a nerdy kid who really likes comic books and they don't talk much. But if you ask them about comic books, you can't shut them up. That's how I feel I am about healthcare and the work that I do. My family, I think in general, is fairly introverted. I've got one kid, one son who's not. We do a lot of things that are around the house, reading. We love movies, nerdy books, and quiet time with family is really how I recharge my battery.
I love that. What other habits do you prioritize to keep you healthy and just to continue to fill that cup?
I like to exercise, and it's good for me and it's stress relief. So I've got one of those little wearable devices that counts my steps, and today I've got 17,379. I got up early this morning And I normally will get up early, exercise, either that or it just doesn't get done.
Yes.
The other hobbies that I have and in general have no redeeming social value. So I do collect comic books. I've collected comic books since I was a kid. I love
Hmm.
Star Wars. I love superhero movies, books that involve dragons, elves, and swords. So stuff that takes me out of
Hmm.
today and it
Sure.
really helps me decompress, let go, and recharge my battery for the next time I'm at work.
I love it. That's great. Okay. So we've talked a lot about leadership, and you have mentioned so many leaders and mentors and people who have influenced you. I know this is a hard question, but if you had to boil it down, what are the three characteristics of the most effective leaders?
I think that they are being a great listener. And I want to distinguish the characteristics of great leaders as opposed to the characteristics of great individual performers or superstars, right? Especially you take a sport like golf, it's not a team-based sport. It's just you out there doing your thing. So to lead people effectively,
Mm.
you've got to be a great listener.
Yeah.
You've got to be able to be self-aware and to process how your team is performing, what it is that's going well. If you've got performance issues there, you've got to be able to acknowledge that. And then being willing to take risks, having a healthy attitude towards taking risks, making decisions in a healthy way, dealing with outcomes that are not what you intended and moving on to something else. So listening, self-awareness, and a willingness to take risk, I think are characteristics of the most effective leaders of people.
Those are fantastic. And so if you had to pick one of those or other characteristics, what's your superpower?
I listen well and I ask good questions. And I like to think that the questioning part at least has some root in my study of philosophy.
Okay.
Right. So people talk about the Socratic method,
Yeah.
and Socrates described himself as a gadfly to Greek society. Part of that Socratic method is that you try to ask questions of the audience to solicit the answers as opposed to a lecture format.
Yeah.
Right. And so I like to try to ask probing questions. I've heard it described as put the skunk on the table, right? If there's a difficult issue, if there's something that people are dancing around,
Yeah.
to try to get that out so that the team can analyze it, evaluate other options, and develop a recommended approach. And so asking good questions with the
Hmm.
belief that inside my team, the right answers are there. If I can do my job effectively, I'm asking good questions to get it out of them.
Ah, that is great. I love that. So I'm reflecting on your 17,000 steps today and your father playing poker with the EVS crew. I'm curious how you stay connected to how many employees and physicians do you have there at MU Healthcare?
8,400 team members and 900 or so providers.
Okay. So how do you stay connected to a system that large?
So I like to be present. And actually, the steps thing is actually part of it. So I walk in the hospital. We have a little cafe in our children's hospital called TJ's. Their
Hmm.
chicken quesadillas and chicken tenders are on point. If you ever are here, Ann, I will
Okay.
treat you to some chicken tenders at TJ's. But I eat lunch every day here in the hospital, out in the lobby. I walk down where our logistics folks are, the cafeteria. So being physically available to
Yeah.
people and recognizable is a part of it. The second thing I would share is the approach that we've taken at MU Healthcare is to be really thoughtful and deliberate about having different ways to connect with staff. So
Hmm.
one of the things that we do, and I think this is pretty common, is like a quarterly town hall. A second thing that we do is something called Coffee with the Chiefs. And this is a little bit more informal. It's usually 10 to 15 frontline staff members and 2 to 3 members of my team.
Hmm.
It is an unstructured hour-long discussion where they can talk about anything they want. We do introductions. I try to learn about whoever is there each day. Where are they from? What's something unusual about them? And after that, it's an hour of them just asking the senior leaders in the organization anything that's top of mind. So
Yeah.
it's parking, it's what are we doing about travelers, it's what's going on with our general wage increase this year, or it's something else. And we do that across multiple settings every month. So 2 to 3 times a month, there are these coffee with the chief sessions where it's just us talking with frontline staff. We've got another structured opportunity in Ask a Leader. So anonymous questions are submitted to the leadership team. And if someone is like uncomfortable putting me on the spot as the CEO, they can submit an Ask a Leader question. I'll try to research the answer. We'll videotape it. And all of those Ask a Leader responses are then on the internet. So anybody who wants to ask the CEO a really tough question, but is worried about having their name attached to it, they've got an opportunity to do it. And then every team member has the opportunity to go back and then see the video answer to that. So in terms of maintaining connection to everyone here, I like food analogies, and we've got cafeteria style options, right? For how people can connect with us, ask
Yeah.
questions, or talk to me about anything that's on their minds.
That's fantastic, because what you're really doing is building trust.
That's right.
That's fantastic. Okay, Rick, you've been very generous. We're going to move into the lightning round portion of this podcast, which is a series of very quick either or questions and just fun questions. So go with your gut. Are you ready?
Yes, ma'am.
Okay, let's do it. All right, you just traveled all over the country for the holidays to see all of your gaggle of children and grandchildren. Tell me your favorite spot in the U.S. to visit.
My favorite spot in the U.S. to visit. Oh, I roll so much, and my favorite spot to visit probably right now is probably Vegas. So my wife and I are, I don't know if foodies is the right term for it,
Yeah.
but we love catching shows and we love eating good meals and being able to go to Vegas every once in a while. Neither of us, I don't, and neither of us gambles. So we don't do any of the
You're
really
there.
fun stuff in Vegas, but food and shows, Vegas.
Fantastic. Well, there's something for everybody in Vegas. Okay, when is the last time you tried something new?
The last time I tried something new was probably a week ago, and it had to do with vegetables at home. That's not terribly adventurous. I'm not a huge like Brussels sprout person. And so trying a dish that had these exciting vegetables is probably the most adventurous thing that I've done in recent memory.
All right. Okay, what time do you wake up and how do you start your day?
I wake up at 4 and
Whoa.
I wake up at 4 and will typically exercise. So I walked 4 miles, came home, showered, got on into work. And so I usually get up at 4, exercise. On the weekends, I might sleep till 6. And mostly because if I don't do it at the beginning of the day, when work gets on me and with the schedule in the evenings, it's just the only time that I have to do it.
It's too much, of course. You are a self-proclaimed nerd. We've discussed this. What's the nerdiest thing you do?
The nerdiest thing I do is probably play video games. Call of Duty, there's a Tom Clancy game called The Division,
Okay.
and then World of Warcraft. Video gaming with my little nerdy headset in Discord is probably the biggest thing.
I love it. Okay. What is the book that you're reading now?
The book that I'm reading now is We Solve Murders, which is, I mentioned it would have no redeeming social value. So it is a mystery kind of comedy,
Yeah.
and it's actually pretty funny.
Okay. What's the best book that you've read on leadership?
The best book I've read on leadership is probably the 5 something or other of a team?
5 Dysfunctions of Team.
Yes, the 5 dysfunctions of a team.
That's right. Patrick Lencioni, I think, right?
Thank you for bailing me
Yes.
out. And did I fail the lightning round because you had to
No,
answer?
no, we're a team here. We are a team,
right.
Rick. Okay. If you could pick a different career, what would it have been?
I would be the manager of a professional sports team. So I love, especially basketball. I would be
Yeah.
like the general manager for the Milwaukee Bucks.
Is that your team?
That is one of them, yes.
One
I'm a
of
big
them.
basketball fan. One of my kids plays college ball.
Oh,
And
nice.
I've grown up just loving basketball, and I would be the general manager for a professional basketball team.
That's fantastic. All right. Well, Ric, we have come to the end of our lightning round and our time together, and I'm going to close us out with the question that all good reporters ask, which is there anything more you'd like to share?
I want to just thank you for the opportunity. It was humbling, flattering to be asked to participate in the podcast, as I had an opportunity to listen to some of the other leaders that you've interviewed. That just heightened how flattering it was to be considered in the company of some of the folks that you've had. So thank you for the opportunity to talk with you today.
Well, thank you for that. It has truly been a pleasure spending time with you and getting to know you. And I'm going to take you up on the chicken fingers at TJ's. So I will see you.
Outstanding.
I will hopefully see you soon. Okay, Ric, thanks very much.
All right, take care, Ann.